Hello, welcome to the abdominal surgery preoperative education video. I'm one of the registered nurses working in the Center for Colorectal Surgery Department at UCSF. This video will answer many of your questions about preparing for surgery and completing the bowel preparation prior to your procedure. In this video, I will discuss how to prepare for surgery, how to complete the bowel prep, and I will also provide a general overview of what to expect. We've listed all of the things we're going to review, as well as the slide number in case you want to come back to a particular topic in the future. Getting ready for surgery. Here are a few simple things that you can do to get ready for surgery that have been shown to improve outcomes. Number 1, walk for 20 minutes twice a day prior to surgery. This will help ensure that your body is prepared for anesthesia and that your lungs are open and working well. Number 2, eat a healthy diet and sufficient protein to ensure you heal well after surgery. Number 3, keep in mind that searching for information online can sometimes feel overwhelming and scary. Also, many sites may have information that is outdated or not accurate. Rather than looking for answers on the internet, we recommend that you bring your questions to your healthcare team so that the answers you get will reflect what is done at UCSF and the specifics of your situation. Before your surgery, what appointments will I have to get ready for surgery? You will have a number of preoperative visits to meet with the team that will be taking care of you and helping you get ready for your surgery. Here is a review of the appointments you will have. 1, a pre-op teach with either the colorectal nurse practitioner, physician's assistant, or nurse. During this 30-minute visit, you will have a chance to review in detail what will happen during your surgical admission, what to expect for recovery, and any other concerns you may have. Here's a tip. Come prepared with all your questions to this visit, as this will be a good time to get them answered. Number 2, prepare clinic or the anesthesia team. You will also have a meeting with our anesthesia team, which is part of our Prepare program, to review your medical and surgical history, as well as discuss what medications to stop prior to surgery. Here's a tip. Please keep in mind that the anesthesia team does not have expertise on the specifics of bowel preparation required for colorectal surgery. Do not discuss bowel prep with the Prepare team. Instead, see the details below about the bowel prep. Stoma pre-teach. If you will be getting an ostomy during your surgery, you will have a visit with either the wound ostomy nurse practitioner or the colorectal nurse to discuss life with an ostomy and get marked on your abdomen for where the stoma will go. This can be done in person or on a video visit. Here's a tip. You will receive a kit in the mail prior to this visit, so have that on hand to use during your discussion. Do I really need to do the bowel prep? You can help prevent infection by preparing your bowels before surgery. In order to reduce the bacteria load, your colon needs to be free of stool. Making sure that your colon is cleaned out prior to surgery is critical in preventing infection after your operation. If your colon is not sufficiently clean, your surgeon may need to reschedule your procedure. What do I need to get for the bowel prep? Fill the following prescriptions a few days before your surgery. Movi Prep, or Go Lightly, or Sue Prep. We order the bowel prep that is covered by your insurance, so you do not have to pay out of pocket. Neomycin sulfate, which is an antibiotic, metronidazole, which is an antibiotic, and Zofran, or ondansetron, which is an anti-nausea medication. If you are using Miralax for your prep, you can purchase this over the counter. Do I need anything else? In addition to preparing for the bowel prep, please make sure that you have a container of Boost Breeze, 8 ounces, or Gatorade regular, 12 ounces, with sugar or other clear carbohydrate drink, such as Ensure Clear, 8 ounces, or Clear Fast, 12 ounces. You should not use this if you are diabetic. You also will need to get Hibiclens soap or chlorhexidine cloths to properly cleanse and prepare your skin prior to surgery. The anesthesia team during the prepare meeting will go over how to do this. Both of these things can be obtained in the colorectal surgery clinic, but are also easily available at most pharmacies over the counter. Today is the day. It's the day before surgery. How should you do your bowel prep? The day before your surgery, you may wake up and drink coffee with milk and sugar, but after 8 a.m., you must switch to clear liquids only. You can and should drink as much clear liquids as you can tolerate. It is important while doing your bowel prep to stay hydrated. And remember, a clear liquid diet means no food all day, only liquids. What is a clear liquid diet? A clear liquid diet consists of liquids you can see through, consumed at room temperature. The purpose is to give your GI or gastrointestinal tract a rest before surgery. It is also important to stay well hydrated during your bowel prep, so please drink as many of the allowed liquids. Please review the allowed liquids in the green and the not allowed liquids in the red. Okay, it's the day before surgery. At 7 a.m., you want to begin a clear liquid diet. Remember, do not eat any solid foods. And remember, if you drink coffee, you can drink coffee in the morning, the day before surgery. So at 7 a.m., if you're taking Miralax, you will mix the entire bottle of Miralax into one 64-ounce bottle of any clear liquid. If you are taking Suprep, you will pour one 6-ounce bottle of the Suprep liquid into the mixing container and then add cool water to the 16-ounce line on the container and mix. Drink all of the liquid in the container over 1 hour. Drink 2 more 16-ounce glasses of water over the next hour. If you got MoviPrep, you will empty the contents of 1 pouch A and 1 pouch B into the MoviPrep container. Add lukewarm water to the fill line and mix completely to dissolve. Drink 8 ounces every 15 minutes or until done over an hour. Then drink 16 ounces of any clear liquids. This timing is important to allow the MoviPrep to wash down the colon at a consistent rate. When you're finished, drink at least 32 ounces of clear liquids. You should expect diarrhea within 1 hour. If you've been given Go Lightly, that powder medication should be given within a 4-liter bottle. Add water to the fill line on the 4-liter container to dissolve the powder. Drink 8 ounces every 15 minutes until completed, usually over 4 hours. Here's a tip. Many patients will add some Crystal Light or other flavor crystals to the Go Lightly container to help with drinking that larger amount of liquid. If you have Miralax, as we said before, drink 8 ounces every 15 minutes until completed over about 2 hours, and then follow up with an additional 32 ounces of any clear liquid once you've finished the bottle. Please feel free to come back to this slide on the day before surgery to help you with preparation. Day before surgery. At 10 a.m., if you are taking MoviPrep or Suprep, repeat the second dose. In this way, you've completed all of your bowel prep, no matter what kind of bowel prep you have, in the morning. The goal is to try to complete the bowel prep in the morning. At 1 p.m., you're going to take your first dose of antibiotics by mouth. 2 neomycin tabs and 2 metronidazole tabs, Follow with 1 glass of water. If you experience nausea, you can take 1 tablet of Zofran every 8 hours, but only as needed. If you are someone who knows that with antibiotics you get nauseous, please plan to take the first dose of the Zofran about 30 minutes prior to your first dose of antibiotics. So at about 12:30 p.m., if you are a person who gets nauseous, then you should take your first dose of Zofran at that time. If you are not someone who gets nauseous with antibiotics, don't worry about it and only take it as needed. At 3 p.m., you'll take your second dose of antibiotics. And then at 10 p.m., you will take your third dose of antibiotics, following the same instructions as the first and second. You can then continue to drink clear liquids until 2 hours before you arrive at the hospital. It's the surgery day. 2 hours before you arrive at the hospital, drink 1 container of Boost Breeze or 8 ounces of Gatorade if you are not diabetic. Do not eat or drink anything after this. Now I would like to review some common questions about bowel prep. Will I be able to complete my bowel prep while traveling to UCSF? No. You will need almost immediate access to a toilet for your bowel prep, which you will complete the day before surgery. Please plan your travel accordingly. For example, if you plan to come to San Francisco the night before surgery, you will need to come 2 nights before surgery so that you are able to complete your bowel prep in the hotel room prior to surgery. Sometimes I experience constipation. Will the bowel prep still work? Most people complete the bowel prep the day before surgery, but if you tend to be constipated, it is a good idea to start your bowel prep sooner, up to 2 to 3 days before surgery. If you're not sure, please contact us. If you're concerned that you may need a longer bowel prep time, please call the colorectal nurses to discuss this so that we make sure we're all in agreement for the plan. I prefer the prep I did for my colonoscopy. Can I do that instead? Yes, you can, but some bowel preps are not on our formulary, and they are difficult for us to prescribe, and some may not be covered by your insurance. Also, please note that although the pill form of bowel prep is very helpful and easy for a colonoscopy, it is not a type of bowel prep that we can use for the day before surgery. If you have any additional questions about that, please contact us. Should I follow the directions my pharmacist gave me or what I see on the box of bowel prep? No. Please follow the bowel prep instructions that we give you, that we've reviewed in this PowerPoint, and that you will also review during your visit with a colorectal nurse or nurse practitioner or physician's assistant. The box that you get your bowel prep in has generic instructions that do not apply to the surgery. Please remember that when you are getting ready to do your bowel prep, you should take it the way that we've reviewed in this PowerPoint and not in the ways that are reviewed or discussed on the box or with your local pharmacist. Thank you. Antibiotics. Why do I need to take antibiotics? They help clean out your colon, they decrease the bacterial load, and they decrease infection after surgery. You will take your first dose of antibiotics by mouth on the day before surgery. Again, just to review, at 1 p.m., you'll take 2 neomycin tabs and 2 metronidazole tabs. You'll follow with 1 glass of water. At 3 p.m., you'll repeat that same dosing. And then at 10 p.m., you'll repeat that same dosing for your third dose of antibiotics. Make sure you are drinking a lot of clear liquids during this time. And remember that you can continue to drink clear liquids until 2 hours before you arrive at the hospital. Please remember that the Zofran or ondansetron medication is an anti-nausea medication that we've sent for you. So if you do experience nausea while taking the antibiotics, feel free to use this medication. Prepare your skin. Should I shower before the operation? Please shower with an antibacterial cleanser, which is called Hibiclens soap, or the chlorhexidine wipes the night before or the morning of your procedure. You will go over this in more detail with the prepare or anesthesia team, so feel free to ask them your questions about the preparation of your skin prior to surgery. Two hours before arrival on surgery day. 2 hours before you arrive at the hospital, drink 1 container of Boost Freeze or 8 ounces of Gatorade or other clear carbohydrate drinks such as Ensure Clear or Clear Fast. You do not need to do this if you are diabetic. Then do not eat or drink anything after this. Why do I need to drink Boost Freeze or Gatorade 2 hours before coming to the hospital? Boost Freeze or Gatorade is a clear carbohydrate drink that decreases the stress of surgery by providing your body glucose during the operation. It is available for free at our clinic. You can also purchase these or a substitute at a drugstore or on Amazon. You will not take this if you are diabetic because it may increase your glucose levels. After the operation, your family will be notified via phone once your procedure is complete. After the procedure, you will be taken to the post-anesthesia care unit or the PACU for an hour or 2 of monitoring while you recover from anesthesia. Once you are stable, you will be taken to your hospital room. Your hospital stay will depend on the surgery you have done and your unique recovery process. Thank you very much for taking the time to review this information in preparation for your surgery. Feel free to review it at any time. If you get sick before surgery, please call the Prepare Clinic at 415-885-7670. If you have any additional questions, you can reach us via MyChart or by phone at 415-885-3606. We look forward to serving you and making your experience the best it can be. Thank you so much for choosing UCSF to receive your care.